Hello everyone. Welcome back to the module of rod and neurosurgery. After having gone through with the brain anatomy and brain surgeries of craniotomy and the stereotactic techniques, there's a next valuable addition to the whole courses about the spinal procedures. So, as you all know, central nervous system has brain and spinal cord. So, whoever is dealing with neural engineering or neural experiments or neural behavioral science, the spine and the spinal cord is a very integral system of the whole neural science. So, keeping that in mind, we have also included the spinal neuroanatomy and the spinal operative approaches and all the requirements and setup that is required and what possible experiments are done in this particular field will be covered in the following sessions. So, today's session is mainly going to be on spinal neuroanatomy. It's very different from what we've been dealing with in last few sessions. So, the vertebral anatomy, the anatomy of the spinal cord, the vascularity, all that is very important to understand the various applications of this knowledge in various spinal related experiments. All right. So, with that brief introduction, let's look at the overall session that I'm going to deal with. Central nervous system, spinal skeletal system, spinal cord vertebrae relation, which is very important to understand. Then the spinal dissection as to what layers that are needed to expose the vertebra and the spinal cord, and briefly about spinal vascularity and the spinal cord structure and circuit briefly. So, that is the entire outline. In the first half I will be covering the top 3, and the next half I will be covering the remaining half of the session. So, to begin with, you all should know what exactly the rat nervous system is composed of. This is a sort of a holistic picture wherein in one image you can see the entire length of the central nervous system. The idea being that it's very important to understand the relation of the spinal cord with the brain, and of course the nerves that comes out of it, and the entire gross anatomy of the entire central nervous system. Because since we are dealing with this in different sections and sessions, you should get a bigger picture as to where does the spinal cord comes and how is it related with the brain and how it conveys the information to the various parts of the body. That's very important to understand. So, as you all can see here, that is the the rodent brain that we dealt with all throughout. So, one can see that is the olfactory bulb and the entire cerebral hemispheres, that is the cerebellum, and underneath which there is a brainstem. So, when we talk about spinal cord as such, that is where it starts from. So, this is known as cervicomedullary junction. All right. So, if you all remember the previous sessions on neuroanatomy, we discussed about something known as brainstem. So, brainstem had 3 parts, that is midbrain, pons and medulla oblongata. It is this medulla which comes in the terminal part of the brain, which continues downwards as spinal cord. All right. So, this junction is very critical. So, it is after this the vertebral anatomy starts, that is cervical vertebrae, thoracic vertebrae, which covers the entire length of the spinal cord. And from the spinal cord, you should remember that there is various cable like structure which goes out from the spinal cord. All right. That is how the nerves are arranged, and the spinal cord is like a big cable I mean, many of you will be electrical engineering and electronics engineering. To get a good comparison, we are dealing with the electrical system, vis-a-vis that there is a large live organic neural cells which acts like sending impulses, and then that will be conveyed like any other electrical cable or electrical wires throughout our body to convey the information from the brain to the periphery, be it a muscle or be it a gland or any other organs in the body. So when we will be dealing with the different structures of the spinal cord, but over and above it's like a tube starting from the brain, which has a central canal which has fluid in it, and similar to what we dealt with the layers covering the brain like dura mater, arachnoid and pia, the entire covering continues along the entire length of the spinal cord. So the cross sectional anatomy of which we will be dealing it in few slides. So but then you all should remember this entire covering of the brain does continue downwards, and if that is the vertebral canal, outside inwards there is a dura, there is arachnoid and pia, only then this spinal cord structure is going to come to visibility. So in order to clear the in order to have a good view of the spinal cord, one has to dissect through multiple layers, and it is very important to understand how do we approach and how do we expose this spinal cord, which is a thin, slender, soft tube within a huge skeletal system, and on top of it there are multiple layers that covers. So that this is the orientation that you all should remember throughout the entire course, because unless we remember that, it is very difficult to sort of understand the relation with the skeletal system, relation with the brain and its various functions. So with that introduction to the entire nervous system, let us look at the paraspinal musculature. So this is very important to understand. As I said, it's not really that important to remember each and every single muscle that comes here, but then you all should understand what sort of dissection is required and what structure need to be cut to expose the underlying vertebra. So as soon as the skin is peeled and folded upwards, and this is a dissection of the paraspinal musculature, you can see that the rat's skin has been completely peeled off and then folded upwards like that, to reveal the entire musculature right from the cervicomedullary junction until the tail. So that is the spinous process right in the middle, and in a bit you will understand what these spinal structures are that I am just describing, but try to focus on these muscles around the spinous process here, and the function of which will be to turn the neck or to lift the upper limb and lift the hip joints or move the hip joints. The orientation has been shown here. The back, this is the area that has been shown here, all right. So that is dorsum. Back of the rodent is called dorsum and the belly will be ventral, all right. So this is the dorsal aspect, and where it continues as the tail as shown here. So once you are oriented, you try to get the attention for the girdle muscles. This is the forepaw girdle muscles and the hind paw girdle muscles, which are important to stabilize the hind paw and the forepaw, all right. So when we deal with the peripheral nerves and the muscles that it innervates, we can discuss more about these muscles, but in order to sort of understand the vertebrae exposure and the maintenance of that exposure before you do a laminectomy. Laminectomy is a procedure where you remove the posterior or back, the covering of the back portion of the vertebra. So vertebral anatomy again will deal with it. So these muscles has to be cut open and maintained laterally, alright. So you will be making incisions here and then expose these muscles only to enter the vertebral canal, that is the spinal canal. So that is very important. So and it is also important which part of the vertebra you are going to deal with. For those experiments which requires only the upper limb motor responses, or for that matter anything to do with forepaw, I will be using this upper and lower limb because of the switch from the human to the rodent. Forepaw is the word that we commonly use for the small animals. So if it is only the forepaw, then it is mostly cervicothoracic vertebra, and if it is the hindpaw, it is lumbar vertebra, and the paraspinal muscle is the thoracic vertebra. So cervical or the cervical region refers to neck. This is thoracic, that is the chest and abdomen. On the dorsum it called thoracic vertebra. Then the lumbosacral and coccygeal, which refers to the tail. So lumbar region refers to the hip, sacrum, the tailbone before it becomes actually the tail, and then the coccygeal bones which are connected with the tail. So these are the various different segments of vertebrae which are covered densely with these paraspinal musculature, alright. So let us look at the entire spinal skeletal system which I just described. So the idea of this picture is to get an orientation as to how the entire spinal skeletal system is assembled with the cranium, which we discussed in last few sessions. So until here we have completed the discussion. So if you all remember, that will be the upper jaw, and that will be the frontal bone, and somewhere there the bregma, parietal bone, interparietal bone, and the occipital bone covering the cerebellum. From here starts the atlas. Atlas is C1, the first cervical vertebra, and if you all remember the terminology atlas from the Greek mythology, which is holding a globe, that is the cranium, and that is how the terminology has evolved as atlas, which is holding this globe. So from then onwards it is all cervical vertebra, as I said, and there will be some other thoracic vertebra, lumbar, sacral and coccygeal vertebra. So this is how the curvature of the spine is also maintained, which is very important to understand these curvature. This is called cervical lordosis. This is thoracic kyphosis. This is normal lumbar lordosis. So these are the, these curvatures are pretty very important in humans, and in rodents it is enough to understand what sort of postural adjustment is required in order to approach this particular vertebra, and how do we make sure that this curve becomes that way so that your approach to each of these cervical vertebra becomes a bit easier. So that is important, and of course you will be knowing the relation of various spinal cord segments. This is the spinal cord, this is the cross sectional MRI. If the section goes in the middle, and that is the mid sagittal plane, this is how it would look like. So you can see the sagittal section of the brain and then the cervical cord. So if you all remember, I said there are multiple layers before we approach. So you can appreciate this skin, subcutaneous tissue, then the muscles, then comes the spinal cord. Before that, this is the vertebral column. So skin, subcutaneous tissue, paraspinal muscles, which we just discussed. Then comes the vertebra, that is the spinal vertebra, that is this. After that layer there are multiple meningeal layers of dura, arachnoid, pia. Only then you will be able to see visualize the spinal cord. So there are almost 5 layers above the cord, and the most tough layer is going to be the vertebral layer, which has to be dealt with the hard instruments and bone rongers, making sure the underlying jelly like tube is not damaged, similar to what we had with the brain surgeries, wherein you are doing a craniotomy, removing the hard bone before you approach the soft brain tissue. And similarly, that is exactly the reason why you need to understand the various anatomical details before you sort of approach the spinal cord, so that the entire surgical outcome is good and the experiment goes as expected. So if one has to look at the entire skeletal system of the rodent, this is where the vertebral column is arranged on the dorsum. So as I said earlier, this is dorsum, this is ventral, all right. So this is rostrum, that is towards the mouth of the organism, and that is caudal. So I am trying to use these terminologies as often as possible, so that you will also get familiarized with, because the most of these anatomical terms are very important when we deal with surgical techniques and various surgical strategies. So if you sort of remove all the other skeletal system, what is left is this spinal skeletal system, where you can appreciate the various segments of vertebral anatomy which I just described. So as I said, that is where the skull stops. So this will be the occipital bone, interparietal bone, parietal, frontal, all right, and then the other facial bones here. So that is the cutoff for the cervicomedullary junction, where the brainstem becomes spinal cord. Within the spinal cord goes the entire length until it becomes the coccygeal segment. So that is atlas, which is the first cervical vertebra. Then the axis. Axis has the odontoid process, along which the head can rotate on the central axis, all right. Then comes the remaining cervical vertebra. Until there is the thoracic vertebra, lumbar vertebra, sacrum, and then it becomes the coccygeal vertebra from there, and then it's all the tail bones, which are known as metatarsals, all right. So this is how the entire spinal skeletal system is arranged. And as I said, when you want to approach the central core, which has the spinal cord, you will be removing the muscle layer there, and then the subcutaneous tissue, then the skin, all right. And next, just after we review, this is the spinous process. This is to have sort of a good orientation that I am trying to explain. You will be approaching from top. The first incision will be on the skin, and then once you retract those skin folds, then the subcutaneous tissue, muscle, and the bone, all right. So we will be using these terminologies as often as possible, and so that every single slide it's a sort of revision for you to remember and orient yourself to approach the spinal cord. So this again shows very clearly all the vertebral classification into different regions altogether. So there are in total 58 vertebrae, all right. So how does it form 58? This you can understand here. So there are around 5 cervical vertebrae, include with the atlas and axis, then the 13 thoracic vertebra, 6 lumbar vertebrae, 4 sacral vertebra, and then there is 1 caudal vertebra and the 30 tail bones, all right. So that is how there are 58 vertebra that forms. It may not be necessary to understand each and every single vertebral sections, but it all depends what sort of a study that you are dealing with. If your study is mostly about the skeletal system, which is really not the neural experiment, but if it is like a focused cervical vertebra approach, and then you are trying to look at dorsal root ganglion or the cervical spinal cord, then you really need to understand how the cervical vertebra is oriented, which vertebra are you going to approach, and how do you expose the posterior element of the cervical vertebra so that you can approach the spinal cord in the end. So, it is very very important to understand what spinal cord segments. For example, if this is the spinal cord, it is not really uniformly smooth inside the vertebral canal. You will see a lot of these spinal roots which exits each of these spinal cord sections. Similar to what you see in the vertebral system, even in spinal cord there is arbitrary division called cervical cord, thoracic cord, lumbosacral cord, and then it tapers down to become coccygeal part of the cord segment. So, there are this spinal cord segment similar to the vertebrae. So, you need to understand which cervical cord segment comes under which cervical vertebra. So, just because there are some 58 vertebra, there are no 58 spinal cord segments. Cord ends somewhere there, that is how the spinal cord goes in, and as you can see in this next few images, you will be able to appreciate where the cord ends. So, for 58 vertebra to accommodate the spinal cord which is shorter, obviously there are multiple segments coming in and covered by a single vertebra. For example, this sacral vertebra covers around 4 to 5 cord segments, alright. Even in cord segment there are C1, C2, C3 up to C8, alright. Similar to what we see in cervical vertebra, where is C1 vertebra, C2. C1 vertebra is known as atlas, C2 vertebra is known as axis. So, similarly you have C7 vertebra. So, there are 7 cervical vertebra, but there are 8 cervical spinal cord segments, alright. So, similarly there are 13 thoracic vertebral segments, and then there are L5 lumbar segments and 5 sacral segments. So, you will understand it further when I deal with the vertebral column and spinal cord relation. So, this is to orient how the segments are arranged within the different spinal vertebra. So, it is also better to know briefly how it would look like. This is the single vertebra. As you can see that we have taken one single vertebra like that, and that is what we are trying to look at in detail. A single vertebra, how is it oriented, what are the different parts of vertebra, and which vertebral part you will be removing in order to expose the spinal cord. That is the whole idea of this. So, again this is dorsal, this is ventral, this is dorsal, this is ventral. This is the side view, this is the AP view. When you see it in front, after you take a cross section and you see it from this is the dorsum, this will be on top. So, if you can feel the spinous process on the back of the rat, when you palpate it, when you feel it, you will be feeling this spinous process on top of the animal, back of the animal. This is the belly, underbelly, so that is ventral, this is dorsal, alright. So, that is how the spinal vertebra will be arranged. So, what the structure that comes right on top, which is palpable, is actually the spine of the vertebra, neural spine. So, and that forms the lamina. So, if I were to put spinal cord here, this is how it would look like. So, this again I will be dealing with. So, the reason why I am trying to orient you with the spinal cord and vertebra is, in order to approach the spinal cord, that bone structure should be removed, which is called laminectomy. Ectomy, as I said earlier, is removal. Removal of the lamina is laminectomy. Alright, so you will be removing the spinous process with the bone raunchure. So either you drill or use the bone raunchure straight and remove this part of the thing, then you will be able to see the outermost covering of the spinal cord. And there are other parts of the vertebra where one vertebra fuses with the other. Alright, so this will be one vertebra and this will be another vertebra behind it, and then like that it continuously forms a spinal skeletal system in this manner. Each vertebra is joined along with the other at these joints. Those are these joints. It's called zygapophysis joints and anapophysis joints. This is the centrum. That is the body of the cervical vertebra, which again is fused with the vertebra behind with what is known as intervertebral disc space. Alright. So, when there is a disc prolapse, there is a nerve which coming out will be compressed. So, the spinal anatomy is again 3-dimensional, just like the brain anatomy, and it is very important which part it's very important to understand the relation of one structure with all the other structures to get a full 3-dimensional orientation. Hence this multiple pictures and images trying to orient you, this is how it is going to be within the body of the rodent. So, this picture beautifully explains the relation of various other structures which I was just explaining. So, this is how the spinal cord is arranged. So, that is the thin slender spinal cord is arranged within the hollow spinal canal. Alright. So, this is this and this is that. This is the side orientation. This, when you take a section in the middle and you turn it around, this is how it would look like. Spinal cord is right in the center, and as you can see, try and appreciate all the coverings that are seen here now. So, this is the innermost part of the spinal canal or the vertebra, after which this layer is dura mater. So, if you remember from the brain anatomy, just a similar covering which is tough is dura mater, then the thin arachnoid which covers the entire neural structure, then the pia mater which is right on the spinal cord, which follows in the various grooves and folds. So, these three coverings has to be open. Generally these two will be handled. Pia will be stuck to the substance of the spinal cord itself. So, once we cut open these structures, then only the spinal cord will be visualized completely. So, before that there are these multiple vessels that comes in around the spinal cord, which we will be dealing it with when we discuss about vascular anatomy. But what you need to also understand is that how the nerve comes out, how does this nerve, peripheral nerve rises, alright. So, brain with the spinal cord is central nervous system, alright. There is something known as PNS, that is peripheral nervous system, central nervous system. This is the central system. PNS conveys the message from the CNS to the peripherals, that is either it is muscle or glands or any other organs which receives nerve supply. So, where does the PNS starts is right from this foramen. This is the dorsal rootlet and that is the ventral rootlet. Dorsum again refers to the top of the body, and the belly portion of the body is ventral again. So, dorsal rootlet. So, root is basically the origin of the nerve, which forms again the peripheral nerve after it goes through various branches as plexus. All right. See, the dorsal rootlet and the ventral root, this carries the sensation, and the ventral rootlet gives away the motor information. So, this is the efferent and that is the afferent. I think that is the basic neural science, I guess most of you must be familiar with, but this is how it is arranged within the spinal canal. From the dorsal horn of this grey matter, which is in the shape of H, the dorsal rootlet arises. From the ventral horn of the spinal cord, the ventral rootlet arises. Both of them fuse to form this peripheral nerve, which also houses what is known as dorsal root ganglion. This structure is known as dorsal root ganglion, which is very important, and again it is a focus for many research, pain related researches or the sensory phenomenon related neural researches. This is one structure which will be targeted, and this is housed in the vertebral foramen here in between the vertebra. When it comes out that way, that is how it is arranged. So, dorsal root ganglion is related with the sensation which carries the impulses towards the brain. All right. Then once it comes out, again it has dorsal rami and ventral rami. This ventral rami again fuse with multiple other nerves and forms what is known as plexus. Then it gives away into divisions and then various branches into a final peripheral nerve. So, that is how this is entirely the peripheral nervous system. I am just trying to introduce another concept which is at the level of interface between the CNS and PNS. This is where it changes. All right. So, today's discussion is going to be only on spinal cord as such. So, that is how the anatomical orientation of spinal cord and the peripheral nerves. So, this is again to help you with the three-dimensional visualization of various structures that we just discussed. So, that is the paraspinal muscles that we just discussed, and that is how it is oriented. That is the cranium, frontal, parietal and occipital bones. All right. So, try to try to visualize and understand the three-dimensional relation of all these structures which we just discussed. So, that is the entire skeletal system, and today's discussion of course is about the spinal skeletal system. So, the idea was basically to orient you as to how the spinal muscles are arranged in and around the skeletal system, all right, and how the spinal vertebra continues from the cranial vertebra. See, there you can see the axis C2, above that will be atlas, and then the other vertebra joins. And you can see this is an example of the intercostal nerves and the housing of the various viscera which is ventral to the spinal canal. If you want to really approach the anterior surface or the ventral surface of the vertebra, then we need to use thoracotomy at that level and laparotomy at this level. All right. So, what we will be approaching, the spinal cord is only through the spinous process from top down approaches. All right. So, and that is the entire skeletal system in the three-dimensional orientation. You can see the intervertebral foramen from which the nerves comes out and supplies the limbs and other organs. So, that is the big spinous process I was just discussing, and these are the transverse processes which comes out of the spinal vertebral body. All right. So, Next important aspect is the spinal cord vertebrae relation. So, this is very important to understand. As I said, you see the number of vertebra and then number of the spinal cord segments. It's difficult to remember exactly where exactly the spinal cord ends and where the vertebral column begins, but it is very important to have at least a rough idea. These days we do have the imaging backup to understand, but then when it comes to surgery again, we need to go by various surface landmarks, we need to go by the skeletal landmarks before we really approach a particular spinal cord segments. So, this gives the exact relation where you can see the first cervical cord segment. Cord segments are divided as per its branches which comes out, the dorsal and ventral rootlet. Imagine if this is the cord, and that is how it would look like. Based on the branch exit of those branches, it becomes C2, C3, C5, C6, 7, 8, so on and so forth. But then the relation with the vertebral body, if you see, C1 is actually at the dorsal part of the C2, and up to C6 it roughly corresponds with the vertebra. But later on you see that there is a big jump. The T4 body has T6 and T5, and if you go on, if you look at this, the middle of L2 body there is a jump to S3, and if you look at T11 there is already L1 coming in, and if you look at the L1 body there is almost the addition of 5 cord segments here. So, that is how the entire spinal cord is housed in the extensive spinal vertebral system. So, how do we remember? One way is to do the preoperative MRI. This is the preclinical MRI, which is not really available in most of the centers, at least not really common in India. So, but then this available from the literature, you can see as to what I meant. You see that is this is the mid sagittal section. It is a sagittal MRI where the section goes through the mid plane as the rat is lying in its anatomical position, where this is dorsum, that is ventral, rostrum and caudal. That is the tail portion, that is the mouth portion there. So, with that orientation you can see these black structures are actually the spinous process of the spinal canal, alright. And as I said earlier, within the hollow spinal canal, there lies the spinal cord. This is the outline of the spinal cord, and you can see this body. Now, this is C2 body and that is C1, that is atlas body. So, try and visualize if there was a bone here, that is how it would look like, alright. Within the central core there is a spinal cord passing through, and you can see here is this is the intervertebral disc. Between two bones there is a disc joint which is formed, so known as intervertebral disc, and look at the relation between the vertebra and the spinal cord segment. This C1 segment is almost towards the end of the C1, C5, C6, C7. So, C7 is under C6. So, it is already started moving, whereas if you look at this, the disparity is very clear. This is a beautiful image where multiple MRI has been fused, something known as a scout image, and then you can see that entire vertebral column is arranged in the order, and then you can see the corresponding spinal cord segments. So, in order to remember this relation easily, this is how we use the relation of cord and vertebrae in humans. So, I sort of taken that rule and see whether it fits into the rodent vertebra as well. So, fortunately it does, and you can see until C6 the cord segment is the same, right. So, then up to T6, then after C6 you need to add at least 1 to know the cord segment. Till T10 you need to add +2, that is, if it is T10, the cord segment that will be within the T10 thoracic vertebra is the T12 cord segment. If it is T8 vertebra, you will be dealing with T. You can understand by have a look at this, you will understand it better. So T9 is T7, so you are adding plus 2, and then you see T6, it has T8 segment, that is again plus 2. So that is the importance from C6 to T5, or you will be adding at least one chord segment, so that is plus 1. So T13 will have L3 to L5, L1 will have L6 to S1, L2 will have S2 to S4, and the spinal cord ends at CO3, that is coccygeal 3. Alright, so L4 vertebra, the spinal cord of the rodent ends, whereas in humans it ends at L1 level, L1 L2 junction. This is where it would end in humans, but in rodents the spinal cord extends till L4 vertebra. So if you are exposing sacrum and coccygeum and all that, you will not be able to visualize the spinal cord, and that is very important to understand if you are trying to approach the coccygeal segment of the spinal cord, which controls its bladder and other autonomic functions. So if you really want to expose the L4 spinal cord, it will be wrong to expose the L4 vertebra, alright, because it will be housing the coccygeal spinal cord segment and not L4 vertebral segment. That is the importance of this particular slide, and it is very important to understand which is the spinal process that you will be exposing and what is the spinal cord segment that will be in relation with that particular vertebra. Anyway, the previous table will guide you directly, and if at all you really want to remember, this is one way to remember. Up to T6 how much you need to add, and up to T10 and up to T12, so on and so forth. So that sort of covers the entire skeletal anatomy. So that ends today's session. So to summarize, I have covered the entire skeletal anatomy of the spine as such, and it is important to understand further how the spinal cord is related and what is the structure of the spinal cord, and what sort of applied anatomy it can be used for the spinal surgery as such. So after the vertebral anatomy in today's session, we will deal with the spinal cord segment in the next session. Thank you all.